Question 1. Mr. Anderson is a 55-year-old male who presents with sudden onset of chest pain and shortness of breath. The physician suspects a possible pulmonary embolism P. Based on his symptoms, the physician decides to order a pulmonary angiogram to PA to evaluate for P. The radiologic technologist prepares the patient for the scan. Which of the following should be the most important consideration for the technologist preparing Mr. Anderson for this imaging procedure? A. Ensuring that Mr. Anderson has a contrast allergy before administering the contrast agent. B. Using the highest possible radiation dose to achieve optimal image quality. C. Asking the patient to remain still for the entire duration of the scan. D. Making sure that Mr. Anderson is positioned supine during the scan. Answer A. Ensuring that Mr. Anderson has a contrast allergy before administering the contrast agent. Explanation. In this scenario, the primary concern is ensuring patient safety, especially in relation to potential allergic reactions to the contrast agent used during a pulmonary angiogram. Before administering contrast, it is vital to confirm if the patient has any known allergies, particularly to iodinated contrast agents. If the patient has a history of contrast reactions, alternative imaging methods or premedication may be considered. Options B, C, and D are not the most critical factors in this situation. While positioning and stillness are important for quality images, D and C, the most immediate concern should be the patient's response to contrast agents. Additionally, radiation dose should always be optimized using the ALARA as low as reasonably achievable. Principle to minimize unnecessary exposure, not maximized. Option B. Question 2. Which of the following imaging modalities would be most appropriate for a patient with suspected liver metastases from a colorectal primary tumor? A. X-ray. B. MRI with contrast. C. CT without contrast. D. Ultra. Answer B. MRI with contrast. Explanation. For evaluating liver metastases, MRI with contrast is the imaging modality of choice due to its superior ability to delineate soft tissue structures, assess liver lesions, and provide high contrast resolution between normal and abnormal liver tissue. Contrast-enhanced MRI, particularly using hepatobiliary contrast agents, is highly sensitive in detecting liver metastases, which is for staging and planning treatment. Optical X-ray is not suitable for liver metastases detection due to its inability to adequately visualize soft tissues. Option C, CT without contrast, would not provide the optimal contrast resolution needed to distinguish liver lesions from surrounding tissue. Option D, ultrasound, is often used for initial screening but is less accurate than MRI in characterizing liver metastases, especially when small or located deep within the liver. Question 3. A radiologic technologist is preparing to perform a fluoroscopic examination on a pediatric patient. The pediatric patient is undergoing a contrast study of the gastrointestinal tract. Which of the following strategies would best reduce the radiation exposure to the patient during the procedure? A. Increase the fluoroscopy frame rate to achieve more detailed imaging. B. Utilize the ALARA principle and minimize the duration of fluoroscopy. C. Use higher levels of contrast agent to enhance image quality. D. Position the patient further away from the fluoroscopy tube to reduce exposure. Answer B. Utilize the ALARA principle and minimize the duration of fluoroscopy. Explanation. The ALARA principle, as low as reasonably achievable, is central to radiation safety, especially in pediatric radiology where radiation sensitivity is higher. Minimizing fluoroscopy time is one of the most effective ways to reduce radiation exposure during procedures like GE studies, while maintaining image quality is important. Unnecessary exposure must be avoided. Option 1. Increasing the fluoroscopy frame rate may improve image resolution but would increase radiation dose, which contradicts ALARA. Option C. Using higher levels of contrast agent does not reduce radiation exposure. It may even increase the risk of complications such as nephropathy. Option D. Positioning the patient further from the tube is not effective in reducing exposure, as the primary method for reducing dose in fluoroscopy is limiting the duration of exposure and using proper shielding, not the patient's distance from the tube. Question 4. During an MRI scan of the brain, the radiologist notes an incidental finding of a small, well-circumscribed lesion in the left temporal lobe. The lesion does not demonstrate any enhancement after the administration of contrast. Based on this information, which of the following is the most likely diagnosis for this lesion? A. Brain abscess. B. Germa. C. Metastatic tumor. D. Schwannoma. Answer D. Schwannoma. Explanation. A schwannoma is a benign tumor of the nerve sheath commonly seen in the brain, particularly near the cranial nerves. The fact that the lesion is well circumscribed and does not enhance after contrast is characteristic of a schwannoma, which tends to be solid and non-enhancing. OPSI was a brain abscess, would typically present with surrounding edema and enhancement after contrast administration, which is not consistent with this case. Option B, glioma, would usually demonstrate diffuse growth and irregular enhancement. Option C, metastatic tumor, would show heterogeneous enhancement and often presents as multiple lesions rather than a single, well-defined one. Question 5. Mr. Lawson, a 60-year-old male with a history of abdominal pain, is referred for a contrast-enhanced CT scan of the abdomen to evaluate for possible mesenteric ischemia. What is the most important consideration in the preparation of the patient for this scan? A. Ensuring the patient is well hydrated and has no contrast to allergies. B. Administering a sedative to relax the patient before the scan. C. Ensuring the patient fasts for at least 8 hours before the exam. D. Positioning the patient in a prone position during the scan. Answer A. Ensuring the patient is well hydrated and has no contrast allergies. Explanation. When performing a contrast-enhanced CT scan, particularly in the abdomen, ensuring proper hydration is critical for optimal contrast enhancement and kidney function. Hydration helps to prevent potential nephropathy, especially in at-risk patients. It is also important to confirm that the patient does not have any allergies to the contrast agent. Option B, sedation is generally not required for abdominal CT scans unless the patient has significant anxiety or is unable to remain still. Option C, fasting is important for certain types of abdominal imaging but is not specifically required for aching unless the physician's instructions indicate otherwise. Option D, prone positioning, is typically not necessary for an abdominal CT, as supine positioning is most common for such scans. Question 6. A 70-year-old male patient with a history of lung cancer presents with difficulty swallowing and weight loss. The contrast swallow study using fluoroscopy is ordered. The radiologic technologist notices a mass in the esophagus during the procedure. What is the most appropriate next step in the management of this finding? A. Immediately refer the patient for A. Canny of the chest. B. Inform the referring physician of the finding and suggest a biopsy. C. Administer more contrast to delineate the mass more clearly. D. Continue the fluoroscopic study to assess for further abnormalities. Answer. B. Inform the referring physician of the finding and suggest a biopsy. Explanation. In the case of a suspected esophageal mass, particularly in a patient with a history of lung cancer, the first priority is to inform the referring physician immediately about the findings. A biopsy is the next logical step to confirm the diagnosis and determine whether the mass is malignant or benign. Early diagnosis is crucial in managing esophageal cancer, which may have spread from the lungs. Option ET scan could be considered for further evaluation, but is not the first step unless directed by the physician. Option C. Administering more contrast would not significantly improve the diagnostic accuracy in this case. Option D. Continue in the fluoroscopy study is unnecessary once the mass is identified. The focus should be on obtaining a definitive diagnosis. Question 7. A 45-year-old female patient is referred for a pelvic ultrasound to investigate possible uterine fibroids. During the scan, the radiologist observes a well-defined hypochoke mass within the myometrium. What is the most likely diagnosis based on these findings? A. Endometriosis. B. Ovarian cyst. C. Uterine fibroid. D. Pelvic inflammatory disease PID. Answer. C. Uterine fibroid. Explanation. Uterine fibroids, leiomyomas, are benign smooth muscle tumors of the uterus commonly found within the myometrium. The appearance of a well-defined hypochoke, dark on ultrasound mass in the myometrium is typical for fibroids. Optional endometriosis generally presents with implants outside the uterus, often in the ovaries or peritoneum, and would not appear as a well-defined mass within the myometrium. Option B. Ovarian cysts are typically located in the ovaries and would have a different appearance, often an anechoic, dark area with a smooth border. Option D. PID involves inflammation and infection, which would typically present with irregular or indistinct masses and associated symptoms such as fever or pain, not a well-defined lesion. Question 8. A patient presents to the emergency department after a motor vehicle accident with complaints of severe back pain. A canny of the spine is ordered. The scan reveals a vertebral compression fracture. Which of the following factors would most likely contribute to the patient's risk of developing compression fracture? A. Smoking and sedentary lifestyle. B. Hypertension and hyperlipidemia. C. Recent history of trauma to the abdomen. D. Previous history of stroke and seizure disorder. Answer A. Smoking and the sedentary lifestyle. Explanation: vertebral compression fractures are often associated with osteoporosis, which can be exacerbated by risk factors such as smoking and a sedentary lifestyle. Smoking decreases bone density, and lack of physical activity reduces bone strength, making the vertebrae more prone to fractures, especially under stress. Option B, hypertension and hyperlipidemia, are not directly associated with an increased risk of vertebral fractures. Option C, trauma to the abdomen, is unrelated to compression fractures of the spine. Option D, stroke and seizure disorder, may affect mobility but is not a common direct risk factor for vertebral fractures. Question 9. A 45-year-old female patient with a known history of breast cancer is referred for a PET scan for staging purposes. Which of the following is the primary advantage of using PET over PET or CT alone in the staging of breast cancer? A. PET offers better resolution of soft tissue structures than MRI. B. PET combines functional and anatomical imaging, providing more accurate staging. C. PET uses less radiation than individual PET or CT scans. D. PET provides more detailed information about bone metastases than other imaging techniques. Answer B. PET combines functional and anatomical imaging, providing more accurate staging. Explanation: PET combines the functional imaging from the PET scan, which detects metabolic activity, with the anatomical imaging from the CT scan, which provides detailed structural information. This combination allows for more accurate localization and staging of tumors, helping clinicians assess both the size and metabolic activity of cancerous lesions. Option is incorrect because MRI provides superior soft tissue resolution compared to PET. Option C is not accurate, as PET generally involves higher radiation exposure compared to PET alone. Option D is not the primary advantage of PET, as bone metastases evaluation is usually better with bone scans or MRI. Question 10. A 30-year-old male with a history of hemoptysis is referred for a chest CT to evaluate possible pulmonary pathology. The CT scan reveals a large, irregular mass in the left lung. Based on the imaging findings, what is the most likely next step in the management of this patient? A. Prescribe a course of antibiotics and follow up in 6 weeks. B. Refer the patient for a biopsy to confirm the diagnosis. C. Order a routine chest X-ray for further assessment. D. Immediately schedule the patient for surgery without further testing. Answer B. Refer the patient for a biopsy to confirm the diagnosis. Explanation: a large irregular mass in the lung, especially in a patient with a history of hemoptysis, raises the suspicion for malignancy. The next step in managing this patient should be obtaining a biopsy to confirm the nature of the mass, whether it is benign or malignant, and to determine the appropriate course of treatment. Option was prescribing antibiotics would be inappropriate without first determining whether the mass is infectious or neoplastic. Option C, chest X-ray, is not appropriate after Aiken as CT provides much more detailed information. Option D, surgery should not be performed without a biopsy to confirm the diagnosis first. Question 11. A 60-year-old female with a history of chronic smoking presents with progressive shortness of breath. A chest X-ray reveals a large mass in the right lung. The mass is well defined and there is no evidence of mediastinal lymphadenopathy. Based on these findings, what is the most likely diagnosis? A. Pulmonary metastases. B. Primary lung cancer. C. Pulmonary fibrosis. D. Pneumonia. Answer B. Primary lung cancer. An explanation: the well-defined mass in the right lung, along with a history of chronic smoking, raises suspicion for primary lung cancer, which is commonly associated with smoking. The absence of mediastinal lymphadenopathy further supports the likelihood of a localized tumor, though metastatic disease cannot be excluded. Optional pulmonary metastases typically results in multiple, often ill-defined nodules, not a solitary well-defined mass. Option C, pulmonary fibrosis, is usually associated with bilateral interstitial changes rather than a well-defined mass. Option D, pneumonia, often presents with consolidation or infiltrates and would not typically form a well-defined mass. Question 12. A 50-year-old male presents with a painful, swollen knee following a sports injury. A radiograph of the knee reveals an irregular bony lesion with cortical involvement. The lesion appears to have a sclerotic rim. What is the most likely diagnosis? A. Osteosarcoma. B. Osteoid osteoma. C. Ewing sarcoma. D. Chondrosarcoma. Answer B. Osteoid osteoma. Explanation: osteoid osteomas are benign bone tumors that are typically present with pain, especially at night, and are characterized by a small, round, well-defined lesion with a sclerotic rim on radiographs. They commonly occur in the long bones, including the femur and tibia. Option's osteosarcoma is a malignant bone tumor that typically presents with aggressive growth and irregular margins, not a well-defined sclerotic rim. Option C, Ewing sarcoma, often presents with large, irregular bone lesions, often with periosteal reaction. Option D, chondrosarcoma, involves cartilage and typically presents with mass that may calcify, but is usually larger and more irregular. Question 13. A 25-year-old female presents with complaints of left-sided abdominal pain, nausea, and vomiting. A pelvic ultrasound reveals an ovarian cyst measuring 6 centimeters. The cyst is simple with smooth borders and an anechoic appearance. What is the most appropriate next step in managing this patient? A. Perform a laparoscopic ovarian cystectomy. B. Prescribe oral contraceptives to prevent further cyst formation. C. Monitor the cyst with follow-up ultrasound in 6 weeks. D. Refer the patient for an EK of the abdomen. Answer C. Monitor the cyst with follow-up ultrasound in 6 weeks. Explanation: a simple ovarian cyst, especially one less than 10 centimeters in size, is often benign and can resolve on its own. The most appropriate management is typically observation with follow-up imaging, in this case a repeat ultrasound in 6 weeks. Optional laparoscopic ovarian cystectomy is not necessary unless the cyst is causing severe symptoms, is suspected to be malignant, or persists despite observation. Option B, oral contraceptives may be used for recurrent cysts but is not the first-line treatment for a simple cyst. Option D, CT scan is generally not needed for a simple ovarian cyst, as ultrasound is sufficient for evaluation. Question 14. A 70-year-old male presents with a history of progressive memory loss and difficulty performing daily activities. A MRI ordered, which reveals generalized cortical atrophy with prominent ventricular enlargement. What is the most likely diagnosis based on these findings? A. Alzheimer's disease. B. Vascular dementia. C. Normal pressure hydrocephalus. D. Frontotemporal dementia. Answer A. Alzheimer's disease. Explanation: the generalized cortical atrophy with prominent ventricular enlargement seen in MRI is a characteristic of Alzheimer's disease, which leads to progressive loss of brain tissue. This atrophy is typically most noticeable in the hippocampal and parietal regions, which are involved in memory and cognition. Option B, vascular dementia, often presents with patchy areas of ischemia or infarction rather than generalized cortical atrophy. Option C, normal pressure hydrocephalus, is associated with ventriculomegaly, but also typically presents with gait disturbance, urinary incontinence, and cognitive decline. Option D, frontotemporal dementia, generally presents with personality changes and behavioral symptoms rather than memory loss. Question 15. A 45-year-old male patient presents with acute right-sided flank pain, hematuria, and nausea. A non-contrast CT scan of the abdomen reveals a 5 mm stone located in the right renal pelvis. What is the most appropriate initial management for this patient? A. Immediate surgery to remove the stone. B. Pain management with NSAIDs and hydration. C. Administer antibiotics to prevent infection. D. Prescribe a diuretic to facilitate stone passage. Answer B. Pain management with NSAIDs and hydration. Explanation: the most appropriate initial management for a patient with a small renal stone less than 6 mm is conservative treatment with pain management, typically NSAIDs and adequate hydration. This allows the stone to pass spontaneously in most cases. Option as surgery is not necessary for small stones unless there are complications or the stone does not pass after conservative treatment. Option C, antibiotics, would only be necessary if there is evidence of infection such as fever or urinary tract infection. Option D, diuretic, is not recommended for stone passage as it may worsen dehydration. Question 16. A 58-year-old male presents with sudden onset chest pain radiating to the left arm. He has a history of hypertension and smoking. An electrocardiogram shows segment elevation in the Roman tomnindef. What is the most likely diagnosis? A. Acute pericarditis. B. Acute myocardial infarction. C. Aortic dissection. D. Pulmonary embolism. Answer: B. Acute myocardial infarction. Explanation: since segment elevation in the inferior omentomna is highly indicative of an acute myocardial infarction, specifically affecting the inferior wall of the heart, the patient's history of hypertension and smoking further supports this diagnosis. Obstructive acute pericarditis may present with chest pain, but typically does not show segment elevation confined to specific leads in the same pattern. Option C, aortic dissection, can cause chest pain, but is typically characterized by sudden severe pain and a different ec pattern. Option D, pulmonary embolism, can cause chest pain and dyspnea, but would typically show signs of right heart strain on ec, not segment elevation. Question 17. A 34-year-old female presents with a history of fever, night sweats, weight loss, and a non-productive cough. A chest X-ray shows a cavitary lesion in the upper lobe of the right lung. A sputum culture is positive for Mycobacterium tuberculosis. What is the most appropriate next step in management? A. Start empiric antibiotics for community-acquired pneumonia. B. Initiate anti-tuberculosis therapy. C. Order a bronchoscopy for further evaluation. D. Perform a chest CT scan for better evaluation of the lesion. Answer: B. Initiate anti-tuberculosis therapy. Explanation: this patient presents with classic signs and symptoms of active tuberculosis (TB), and the positive sputum culture for Mycobacterium tuberculosis confirms the diagnosis. The most appropriate management is the initiation of standard anti-tuberculosis therapy. Option calls empiric antibiotics is not appropriate because the diagnosis is confirmed as tuberculosis, not pneumonia. Option C, bronchoscopy, is typically reserved for cases where the diagnosis is uncertain, which is not the case here. Option D, chest CT scan, may provide further details but is not necessary for diagnosis when sputum culture is positive. Question 18. A 45-year-old woman presents with fatigue, weight gain, and cold intolerance. On physical examination, she has dry skin, bradycardia, and a palpable goiter. Laboratory studies show elevated TH and low Freed. What is the most likely diagnosis? A. Hypothyroidism. B. Hypothyroidism. C. Thyroiditis. D. Pituitary adenoma. Answer: B. Hypothyroidism. Explanation: the patient's symptoms, fatigue, weight gain, cold intolerance, and physical findings, dry skin, bradycardia, goiter, suggest hypothyroidism. The laboratory results showing elevated TH and low free T are consistent with primary hypothyroidism where the thyroid gland is underactive, causing an elevated TH in response to low thyroid hormone levels. Options with hypothyroidism would present with symptoms such as weight loss, heat intolerance, and tachycardia with suppressed TSH and elevated thyroid hormones. Option C, thyroiditis, could cause thyroid dysfunction, but the presentation here is more consistent with hypothyroidism. Option D, pituitary adenoma, could cause secondary hypothyroidism, but the primary problem is most likely thyroid-related based on the lab results. Question 19. A 40-year-old male with a history of chronic alcohol use presents with confusion, ataxia, and ophthalmoplegia. On physical examination, he has nystagmus and a Y-based gait. What is the most likely diagnosis? Say alcohol withdrawal syndrome. B. Wernicke's encephalopathy. C. Korsakoff syndrome. D. Hypoglycemia. Answer: B. Wernicke's encephalopathy. Explanation: Wernicke's encephalopathy is neurological emergency caused by thiamine, vitamin B deficiency often seen in chronic alcoholics. It is characterized by the classic triad of confusion, ataxia, and ophthalmoplegia, including nystagmus. Option: alcohol withdrawal syndrome can cause confusion and tremors but would not explain the ophthalmoplegia and ataxia seen in this patient. Option C, Korsakoff syndrome, is long-term complication of Wernicke's encephalopathy and is associated with memory deficits and confabulation, but it does not present with acute neurological symptoms. Option D, hypoglycemia, can cause confusion and ataxia, but would not explain the ophthalmoplegia. Question 20. A 65-year-old male with a history of chronic kidney disease presents with nausea, vomiting, and muscle weakness. His laboratory results reveal hypokalemia, elevated creatinine, and a low pH. His X shows peaked T waves. What is the most likely cause of his symptoms? A. Acute myocardial infarction. B. Acute renal failure with hyperkalemia. C. Diabetic ketoacidosis. D. Adrenal insufficiency. Correct answer: B. Acute renal failure with hyperkalemia. Explanation: the patient's symptoms of nausea, vomiting, muscle weakness, and findings of peaked T waves, along with elevated creatinine and hyperkalemia, are consistent with acute renal failure complicated by hyperkalemia. The kidney's inability to excrete potassium leads to elevated potassium levels, which can cause changes such as peaked T waves. Acute myocardial infarction can cause nausea and vomiting, but is not associated with hyperkalemia or the findings described. Option C, diabetic ketoacidosis, can cause nausea, vomiting, and a low pH, but hyperkalemia is usually accompanied by a normal or elevated bicarbonate level, not a low pH. Option D, adrenal insufficiency, can cause muscle weakness and nausea, but it would not explain the hyperkalemia and changes seen in this patient. Question 21. A 55-year-old male with a history of hypertension presents with sudden onset severe chest pain radiating to his back. He appears distressed and has a blood pressure of 100/110 FD. A chest X-ray shows a widened mediastinum. What is the most likely diagnosis? A. Acute myocardial infarction. B. Pulmonary embolism. C. Aortic dissection. D. Pericarditis. Answer: C. Aortic dissection. Explanation: the patient's presentation of sudden severe chest pain radiating to the back, along with widened mediastinum on chest X-ray, is highly suggestive of aortic dissection. Aortic dissection occurs when there is tear in the aortic wall, leading to blood entering the aortic wall and causing severe pain. The history of hypertension is major risk factor. Option: acute myocardial infarction presents with chest pain, but typically does not cause back pain or widened mediastinum. Option B, pulmonary embolism, could cause chest pain and dyspnea, but would not explain the widened mediastinum. Option D, pericarditis, typically causes pleuritic chest pain and would not cause widened mediastinum. Question 22. A 28-year-old female presents with a history of joint pain, a butterfly-shaped rash across her cheeks, and photosensitivity. Her laboratory results show positive anti-nuclear antibodies on an anti-double-stranded DNA antibodies. What is the most likely diagnosis? A. Rheumatoid arthritis. B. Systemic lupus erythematosus. C. Psoriatic arthritis. D. Sjogren's syndrome. Answer: B. Systemic lupus erythematosus. Sleep. Explanation: the patient's presentation of joint pain, butterfly-shaped rash, and photosensitivity, along with positive on an anti-double-stranded DNA antibodies, is highly suggestive of systemic lupus erythematosus. SLE is an autoimmune disease that can affect multiple organ systems and is characterized by the presence of specific antibodies. Option: rheumatoid arthritis, typically causes joint inflammation but does not present with butterfly-shaped rash or photosensitivity. Option C, psoriatic arthritis, is associated with psoriasis and does not typically cause butterfly rash. Option D, Sjogren's syndrome, primarily affects exocrine glands and is not typically associated with the butterfly rash or the positive antibodies seen in SLE. Question 23. A 22-year-old male presents with a painful, swollen left knee following an injury during a soccer match. He has difficulty bearing weight on the leg. A physical examination reveals a positive Lachman test and anterior drawer test. What is the most likely diagnosis? A. medial collateral ligament MCL sprain. B. anterior cruciate ligament ACL tear. C. meniscal tear. D. patellar dislocation. Answer: B. anterior cruciate ligament ACL tear. Explanation: the positive Lachman test and anterior drawer test are classic signs of an anterior cruciate ligament ACL tear. The ACL is responsible for stabilizing the knee, and a tear can cause significant pain, swelling, and difficulty with weight bearing. Osteomial sprain typically causes medial knee pain and instability, but would not cause positive Lachman and anterior drawer tests. Option C, meniscal tear, can cause knee pain and swelling, but does not typically present with a positive Lachman or anterior drawer test. Option D, patellar dislocation, presents with a deformity and inability to move the patella that would not cause a positive Lachman or anterior drawer test. Question 24. A 50-year-old female presents with a history of irregular periods, hot flashes, and vaginal dryness. Her last menstrual period was 12 months ago. What is the most appropriate next step in management? A. Start hormone replacement therapy HRT. B. Perform a pelvic ultrasound. C. Order a serum FSH test. D. Prescribe oral contraceptives. Answer: C. Order a serum FH test. Explanation: the patient is likely experiencing menopause, which is defined as the cessation of menstrual periods for 12 consecutive months. The most appropriate next step is to measure serum follicle stimulating hormone (FSH), which is typically elevated during menopause. This can confirm the diagnosis. Option-basal hormone replacement therapy may be considered for managing menopausal symptoms, but is not the first step in diagnosing menopause. Option B, pelvic ultrasound, may be useful for evaluating other gynecological issues, but is not necessary for diagnosing menopause. Option D, oral contraceptives, are not appropriate for a woman who has already missed her period for 12 months. Question 25. A 24-year-old female presents with recurrent headaches, blurred vision, and nausea. On physical examination, she has a papilledema. MRI shows no structural abnormalities, but lumbar puncture reveals an elevated opening pressure. What is the most likely diagnosis? A. Idiopathic intracranial hypertension, pseudotumor cerebri. B. Brain tumor. C. Meningitis. D. Subarachnoid hemorrhage. Answer: A. Idiopathic intracranial hypertension, pseudotumor cerebri. Explanation: the patient's presentation of headaches, blurred vision, nausea, papilledema, and elevated opening pressure on lumbar puncture is most consistent with idiopathic intracranial hypertension, also known as pseudotumor cerebri. It is characterized by increased intracranial pressure without clear cause, often affecting young women. Option B, brain tumor, can cause similar symptoms but would typically show structural abnormalities on MRI. Option C, meningitis, typically presents with fever, stiff neck, and altered mental status, which is not described in this case. Option D, subarachnoid hemorrhage, presents with sudden severe headache and signs of meningeal irritation, which are not present in this patient. Question 26. A 45-year-old male presents with a non-productive cough, fever, and weight loss for the past few weeks. He has a history of travel to an area endemic for tuberculosis. His chest X-ray shows a cavitary lesion in the upper lobe of the right lung. What is the most likely diagnosis? A. Community-acquired pneumonia. B. Tuberculosis. C. Lung abscess. D. Bronchitis. Answer: B. Tuberculosis. Explanation: the patient's symptoms of non-productive cough, fever, weight loss, and the chest X-ray showing a cavitary lesion in the upper lobe are highly suggestive of tuberculosis (TB), a chronic infection caused by Mycobacterium tuberculosis, and can present with pulmonary symptoms and characteristic radiographic findings. Option was as community-acquired pneumonia, typically presents with productive cough, consolidation on X-ray, and more acute symptoms. Option C, lung abscess, can present with a cavitary lesion but usually occurs after aspiration pneumonia and presents with a productive cough. Option D, bronchitis, would present with a productive cough and does not cause cavitary lesions. Question 27. A 70-year-old female with a history of osteoarthritis complains of joint pain, stiffness, and difficulty getting up from a chair. On examination, she has reduced range of motion in both hips with no redness or warmth. What is the most likely diagnosis? A. Rheumatoid arthritis. B. Osteoarthritis. C. Gout. D. Ankylosing spondylitis. Answer: B. Osteoarthritis. Explanation: the patient's symptoms of joint pain, stiffness, and difficulty with movement, along with the examination findings of reduced range of motion in both hips, are typical of osteoarthritis. OA is a degenerative joint disease commonly affecting weight-bearing joints like the hips and knees, and it is associated with joint stiffness and pain, especially after activity or prolonged sitting. Option-basal rheumatoid arthritis is an inflammatory condition that typically causes joint swelling, warmth, and redness, which is not present in this case. Option C, gout, often presents with acute joint pain and swelling, typically in the big toe. Option D, ankylosing spondylitis, generally affects the spine and sacroiliac joints, causing back pain and stiffness. Question 28. A 55-year-old male with a history of smoking presents with a productive cough, dyspnea, and wheezing. His spirometry shows a reduced VEF ratio that improves with bronchodilator therapy. What is the most likely diagnosis? A. Asthma. B. Chronic obstructive pulmonary disease, COPD. C. Pulmonary fibrosis. D. Lung cancer. Answer: B. Chronic obstructive pulmonary disease, COPD. Explanation: the patient's history of smoking and symptoms of chronic cough, dyspnea, and wheezing, along with the spirometry findings of reduced FeF ratio that improves with bronchodilator therapy, are most consistent with chronic obstructive pulmonary disease (COPD). COPD is progressive obstructive lung disease often caused by smoking and is characterized by airflow limitation that is not reversible. Option: asthma can also cause wheezing and reversible airflow limitation, but usually presents earlier in life and has more variability in symptoms. Option C: pulmonary fibrosis typically presents with progressive dyspnea and dry cough, but is not associated with reversible spirometry pattern. Option D: lung cancer can present with cough and dyspnea, but would not cause reversible airflow limitation on spirometry. Question 29. A 25-year-old male presents with a history of recurrent abdominal pain, bloating, and diarrhea for the past 6 months. He also reports a family history of similar symptoms. His stool tests are negative for infectious causes. What is the most likely diagnosis? A. Irritable bowel syndrome (IBS). B. Celiac disease. C. Crohn's disease. D. Lactose intolerance. Answer A. Irritable bowel syndrome (IBS). Explanation: the patient's symptoms of recurrent abdominal pain, bloating, and diarrhea, along with the negative stool tests for infectious causes, suggest irritable bowel syndrome (IBS). IBS is functional gastrointestinal disorder that often presents with abdominal discomfort and changes in bowel habits, such as diarrhea or constipation, without an identifiable organic cause. Option B, celiac disease, can present with gastrointestinal symptoms but would typically be associated with malabsorption and positive serologic markers, e.g. TG antibodies. Option C, Crohn's disease, can cause abdominal pain and diarrhea but is typically associated with inflammatory markers and may present with weight loss or rectal bleeding. Option D, lactose intolerance, causes bloating and diarrhea, but would be relieved with avoidance of lactose-containing foods and would not cause recurrent pain or family history of similar symptoms. Question 30. A 40-year-old male with a history of alcohol use disorder presents with confusion, ataxia, and ophthalmoplegia. His blood glucose is 75 mg/dL. Was the most likely diagnosis? A. Wernicke's encephalopathy. B. Delirium tremens. C. Alcoholic hepatitis. D. Hypoglycemia-induced coma. Answer A. Wernicke's encephalopathy. Explanation: the patient's symptoms of confusion, ataxia, and ophthalmoplegia in the setting of alcohol use disorder are highly suggestive of Wernicke's encephalopathy. This condition is caused by thiamine, vitamin B deficiency, often seen in chronic alcoholics, and can present with the classic triad of symptoms. Option B, delirium tremens, is a severe form of alcohol withdrawal characterized by agitation, tremors, and hallucinations, but it typically occurs within 4, 8, 7, 2 hours of the last drink. Option C, alcoholic hepatitis, causes liver dysfunction with jaundice, abdominal pain, and hepatomegaly, but it would not cause the neurological symptoms seen here. Option D, hypoglycemia-induced coma, could cause confusion, but the patient's blood glucose is 75 mg/dL, which is not low enough to explain the symptoms.